As we mentioned earlier, the Congressional Budget Office released its price tag Monday for the American Health Care Act. The CBO predicts the bill that would replace Obamacare would leave 14 million more people uninsured by the end of next year, and 24 million people will be without insurance by 2026. Doug Elmendorf is dean of the Harvard Kennedy School and former director of the Congressional Budget Office. He was at the CBO when Obamacare passed. He joins me now from Cambridge. Doug, thanks for being with us.
Thank you.
So you've had a chance to look at these numbers. What is your biggest takeaway from this CBO report?
The most striking part of the estimate is that the big decline in the number of Americans without health insurance that we've seen under the Affordable Care Act would be nearly entirely reversed under this legislation.
And, you know, I want to just probe you a little bit further on that. House Speaker Paul Ryan, of course, who is behind this bill, released a statement saying that the CBO finds this legislation will provide massive tax relief, dramatically reduce the deficit, and make the most fundamental entitlement reform in more than a generation. And this written statement goes on to say, it's important to note that this report does not take into consideration additional steps Congress and the Trump administration are taking that will further lower costs and increase choices. What do you think about that?
Well, I think the speaker is right. This is a large tax cut for higher income people, and it is a large cutback in benefits for lower income people. And that is an aspect of entitlement reform we have not seen. We haven't seen it because it's not very politically popular. Remember, the president promised that everybody would be taken care of and that he would not cut Medicaid. Secretary Price said yesterday that he thought nobody would be worse off. So this legislation directly contradicts their assertions about the policy they're aiming for. And that's the tension the Republicans have. If you want to cut taxes by a lot, and the taxes in the ACA were mostly leveled at higher income people, then you have to cut benefits by a lot, and they're doing that.
So what changes you think can be made to improve the bill, in your view?
Well, this really is Obamacare light. It keeps some of the elements of the Affordable Care Act in place, but cuts way back on the subsidies. And the only way to return people to health insurance who would be taken off under this bill is to put back more of the subsidies and more of the other structure of the Affordable Care Act. That's why the Republicans are stuck. It's not an accident. They've ended up with a bill that makes a lot of people unhappy because they promised to both maintain insurance coverage, maintain access to insurance coverage, and have a lot of budgetary savings. And you can't do all of that. People are losing access to insurance coverage if this bill goes through. CBO estimated that a 64-year-old earning $26,000 would pay $13,000 more for health insurance under this legislation. And that health insurance would have twice the deductibles and copayments of the current insurance that person can buy in one of these insurance marketplaces. So it has very negative effects on middle and lower income people who are depending on the Affordable Care Act, while leaving in place subsidies for a lot of the rest of us who get health insurance through our employers and have big tax subsidies when we do that.
So Speaker Ryan talked to our John Dickerson of Face the Nation about this on Sunday, about people potentially losing coverage under the bill. Let's play a little bit of that sound.
How many people are going to lose coverage under this new?
I can't answer that question. It's up to people. Here's the premise of your question. Are you going to stop mandating people buy health insurance? People are going to do what they want to do with their lives because we believe in individual freedom in this country. So the question is, are we providing a system where people have access to health insurance if they choose to do so? And the answer is yes.
What's your reaction to that? I mean, he went on to say that fewer people would be covered because the bill gets rid of the individual mandate. Is the missing mandate the reason why the CBO assessment says that millions of people will lose their health coverage?
The missing mandate is only part of the reason. I think a bigger part of the reason people will lose health insurance coverage is they won't be able to afford it. People are not maintaining access to health insurance coverage or gaining access to health insurance coverage in this legislation. People are being taken out of Medicaid. The subsidies are being cut back by 40% on average in the insurance marketplaces. So the bill is not maintaining access and giving people freedom to choose, as the speaker suggested. It is reducing access very significantly. You know, under the Affordable Care Act, the number of people in this country without health insurance fell by about half. And under this legislation, it would go right back up again.
Lastly, Doug, as you know, the White House had been downplaying the CBO score even before it came out. I want to play a little bit of what White House Press Secretary Sean Spicer said on Monday.
I think when you look at whatever that number is, whether it's budget projections or whatever, I think there's a track record that goes along a lot of times with whether or not the projections in certain areas, whether it's unemployment, budgetary numbers, whatever, are what the track record is. All I'm suggesting to you is very clearly that the numbers that they did the last time they did healthcare were off by more than 50% when it came to the number of people insured. That's not my interpretation. That's a fact. And I think it's important for people to understand the differences.
What's your reaction to that, Doug? He's talking about your office when you were director of the CBO. And also, for people who aren't familiar, could you just give us a little bit of an overview of why it is that when we say the CBO is nonpartisan, this is an organization that is viewed in many circles as being just that, independent?
Yes. Well, for example, I was appointed as director when the Democrats controlled both the House and the Senate. I was reappointed when the Republicans controlled the House but not the Senate. The current director, Keith Hall, was appointed when Republicans controlled both the House and the Senate. But the modeling, the expertise that's brought to bear in these estimates is the same today as it was when I was director working on the Affordable Care Act 7 and 8 years ago. I think that Sean Spicer is exactly right to look at the track record. The track record is that CBO did not get this estimate exactly right. We didn't get it as right as I wanted to. But we were absolutely right on the broad contours of what this legislation would do, because we expected that the number of people without health insurance would fall sharply, and it did. It didn't fall quite as much as we'd expected. Now, within the numbers of people getting health insurance, we underestimated the number getting it through Medicaid and overestimated the number who would get it through these insurance marketplaces. So the particular number that Sean Spicer refers to is our error in predicting enrollment in the insurance marketplaces. But as I say, we overestimated that piece, underestimated another piece. So the overall gain in insurance coverage was less than we expected, but not a lot less than we expected. So our track record, and look, I wish we'd done this exactly right, but our track record was a lot better than the track record of most people who were just holding forth without doing the analysis in 2009 and 2010.
All right, former CBO Director Doug Elmendorf, thanks very much, Doug, for your perspective. Appreciate it.
Thank you.